Are you searching for information about Leuprolide? In this video, we will provide a comprehensive guide on the uses, dosing information, side effects, and user feedback of Leuprolide. Leuprolide, also known by its brand name, Eligard, Lupron Depot, is commonly used to treat various medical conditions. This medication is often prescribed for conditions such as endometriosis, prostate cancer, precocious puberty, and infertility due to its ability to suppress certain hormone production in the body. When it comes to dosing, Leuprolide is available in various forms, including injections and implants. The dosage and duration of treatment will depend on the specific condition being treated and the medical professional's recommendation. Like any medication, Leuprolide may have possible side effects. These can include hot flashes, mood swings, headaches, and injection site reactions. It's important to consult with your healthcare provider for a complete list of potential side effects and to address any concerns you may have. To provide a well-rounded perspective, we will also share user feedback and experiences with Leuprolide. This will help you gain insights into real-life experiences and make informed decisions about your healthcare journey. So, if you're curious about Leuprolide and its uses, dosing information, side effects, and user feedback, keep reading. What is Leuprolide? Leuprolide, also known by its brand name, if provided, is a medication commonly used to treat a range of medical conditions. This medication is particularly effective in addressing conditions such as endometriosis, prostate cancer, precocious puberty, and infertility. Its main mechanism of action involves suppressing the production of certain hormones in the body. Leuprolide is available in various forms, including injections and implants, and the specific dosage and duration of treatment will depend on the condition being treated and the guidance of a healthcare professional. As with any medication, Leuprolide may have potential side effects, which can include hot flashes, mood swings, headaches, and injection site reactions. Consulting with a healthcare provider is essential to understand the complete list of potential side effects and address any concerns. To provide a well-rounded perspective, it is also important to consider user feedback and experiences with Leuprolide. Real-life experiences can offer valuable insights and help individuals make informed decisions about their healthcare journey. Common conditions treated with Leuprolide. Leuprolide is prescribed for various medical conditions due to its ability to regulate hormone production in the body. Here are some of the most common conditions for which Leuprolide is used. Endometriosis. Leuprolide is often prescribed to manage the symptoms of endometriosis, a condition where the tissue lining the uterus grows outside of it. By suppressing the production of certain hormones, Leuprolide can help reduce pain, inflammation, and the growth of endometrial tissue. Prostate cancer. Leuprolide is frequently used in the treatment of advanced prostate cancer. Prostate cancer is often hormone-dependent, meaning it relies on the production of certain hormones to grow and spread. By inhibiting hormone production, Leuprolide can help slow down the progression of the disease. Precocious puberty. Precocious puberty is a condition in which children begin puberty earlier than usual. Leuprolide can be used to delay the onset of puberty and provide more time for physical and emotional development. Infertility. In some cases, Leuprolide may be prescribed as part of fertility treatments. By regulating hormone levels, it can help stimulate ovulation and improve the chances of successful conception. These are just a few examples of the conditions for which Leuprolide is commonly prescribed. The specific treatment plan and duration will be determined by a healthcare professional based on individual circumstances. How does Leuprolide work? Leuprolide belongs to a class of medications known as gonadotropin-releasing hormone, GnRH, agonists. GnRH is a hormone released by the hypothalamus in the brain, which stimulates the pituitary gland to produce and release other hormones, such as luteinizing hormone, LH, and follicle-stimulating hormone, FSH. These hormones are involved in the regulation of reproductive processes. Leuprolide works by initially stimulating the release of LH and FSH, leading to a temporary increase in hormone production. However, with continued use, it desensitizes the pituitary gland, causing a decrease in the production of LH and FSH. This decrease in hormone levels can be beneficial in treating conditions such as endometriosis, prostate cancer, and precocious puberty, where hormone production needs to be suppressed. By reducing the production of certain hormones, Leuprolide helps to alleviate symptoms and slow down the progression of these conditions. However, it is important to note that Leuprolide is not a cure and may require ongoing treatment to maintain its effectiveness. Dosage information for Leuprolide. The dosage and duration of Leuprolide treatment will vary depending on the specific condition being treated and the recommendations of a healthcare professional. Leuprolide is available in different forms, including injections and implants. The choice of formulation will depend on factors such as convenience, the desired duration of treatment, and individual patient preferences. For example, in the treatment of endometriosis, Leuprolide injections are typically administered once every month or every 3 months. The duration of treatment may range from a few months to several years, depending on the severity of symptoms and the individual's response to the medication. In the case of prostate cancer, Leuprolide injections can be given monthly or every 3 to 6 months, depending on the specific treatment plan. The duration of treatment may vary from a few months to several years, depending on the stage and progression of the disease. It is important to follow the prescribed dosage and administration schedule provided by a healthcare professional. They will consider factors such as the individual's medical history, response to treatment, and any potential interactions with other medications. Potential side effects of Leuprolide. Like any medication, Leuprolide may have potential side effects. It is essential to be aware of these side effects and to consult with a healthcare professional if any concerns arise. The most commonly reported side effects of Leuprolide include hot flashes. Many individuals experience hot flashes, similar to those associated with menopause, while taking Leuprolide. These episodes can be intense and may cause discomfort and sweating. Mood swings. Some individuals may experience changes in mood, including feelings of irritability, anxiety, or depression. It is important to discuss any significant mood changes with a healthcare professional. Headaches. Headaches are a common side effect of Leuprolide and can range from mild to severe. If headaches persist or worsen, medical advice should be sought. Injection site reactions. For individuals receiving Leuprolide injections, redness, swelling, or pain at the injection site may occur. It is important to monitor the injection site and report any severe or persistent reactions to a healthcare professional. These are some of the most commonly reported side effects associated with Leuprolide. However, it is important to note that not all individuals will experience these side effects, and the severity and duration may vary. Additionally, there may be other less common side effects associated with Leuprolide, so it is crucial to consult with a healthcare professional for a complete list and guidance. User feedback and experiences with Leuprolide. Real-life experiences and user feedback can provide valuable insights into the effectiveness and tolerability of a medication like Leuprolide. It is important to note that individual experiences can vary, and what works for one person may not work for another. However, hearing about the experiences of others can help individuals make more informed decisions about their own treatment options. User feedback on Leuprolide often highlights both positive and negative aspects of the medication. Some individuals report significant improvements in their symptoms and quality of life after starting Leuprolide treatment. For example, individuals with endometriosis may experience reduced pain and improved menstrual regularity. Similarly, individuals with prostate cancer may see a decrease in the size of tumors and a slowing down of disease progression. However, it is also important to consider the potential challenges and side effects that some individuals may experience. User feedback often mentions side effects such as hot flashes, mood swings, and headaches. These side effects can vary in intensity and duration, and some individuals may find them more bothersome than others. Overall, user feedback and experiences with Leuprolide can provide valuable insights, but it is important to remember that individual responses may vary. Consulting with a healthcare professional is essential to determine the suitability of Leuprolide for a specific condition and to address any concerns or questions. Precautions and considerations when using Leuprolide. Before starting Leuprolide treatment, it is important to discuss any existing medical conditions, medications, or allergies with a healthcare professional. Certain conditions or medications may interact with Leuprolide, potentially affecting its effectiveness or causing additional side effects. Additionally, it is essential to inform the healthcare professional if there is a history of bone density loss, as Leuprolide treatment may exacerbate this condition. Regular monitoring and appropriate interventions can help manage any potential bone density issues. It is important to note that Leuprolide should not be used during pregnancy or if there is a chance of pregnancy. The medication can harm an unborn baby, and reliable contraception should be used throughout the duration of treatment. For individuals with prostate cancer, regular monitoring of prostate-specific antigen, PSA, levels may be necessary to assess the response to treatment and monitor disease progression. As with any medication, it is crucial to follow the prescribed dosage and administration schedule provided by a healthcare professional. If a dose is missed, it should be taken as soon as possible, unless it is close to the time for the next scheduled dose. Double doses should not be taken to make up for a missed one. Alternatives to Leuprolide for treating similar conditions. Depending on the specific condition being treated, there may be alternative medications or treatment options available. It is important to discuss these alternatives with a healthcare professional to determine the most suitable approach for individual circumstances. Some alternatives to Leuprolide for treating similar conditions include endometriosis. Other medications commonly used to treat endometriosis include nonsteroidal anti-inflammatory drugs, NSAIDs, hormonal contraceptives, and progestins. In some cases, surgery may be recommended to remove endometrial tissue. Prostate cancer. Alternatives to Leuprolide for the treatment of prostate cancer may include other hormonal therapies, such as anti-androgens or androgen receptor blockers. Radiation therapy and surgery may also be options depending on the stage and progression of the disease. Precocious puberty. In addition to Leuprolide, other medications known as GnRH agonists, such as triptorelin or goserelin, may be used to treat precocious puberty. These medications work in a similar way to Leuprolide by suppressing hormone production. Infertility. Depending on the cause of infertility, other treatment options may include fertility medications, assisted reproductive technologies, ART, such as in vitro fertilization, IVF, or surgery to address underlying issues. The choice of treatment will depend on various factors, including the specific condition, individual circumstances, and the guidance of a healthcare professional. It is important to weigh the potential benefits and risks of each option and make an informed decision. Frequently asked questions about Leuprolide. Is Leuprolide a form of chemotherapy? Leuprolide is not a form of chemotherapy. It belongs to a class of medications known as gonadotropin-releasing hormone, GnRH, agonists and is used to regulate hormone production in the body. Can Leuprolide be used during pregnancy? Leuprolide should not be used during pregnancy or if there is a chance of pregnancy. It can harm an unborn baby, and reliable contraception should be used throughout the duration of treatment. What should I do if I miss a dose of Leuprolide? If a dose of Leuprolide is missed, it should be taken as soon as possible, unless it is close to the time for the next scheduled dose. Double doses should not be taken to make up for a missed one. Can Leuprolide cause weight gain? Weight gain is not a commonly reported side effect of Leuprolide. However, individual responses to medications can vary, and it is important to discuss any concerns about weight changes with a healthcare professional. Can Leuprolide be used for conditions other than those mentioned? Leuprolide may be used for other conditions not mentioned in this video. It is important to consult with a healthcare professional to determine the suitability of Leuprolide for a specific condition. How long does it take for Leuprolide to start working? The onset of action of Leuprolide can vary depending on the specific condition being treated. It is important to follow the prescribed treatment plan and consult with a healthcare professional for more information. Conclusion. Leuprolide is a medication commonly used to treat various medical conditions such as endometriosis, prostate cancer, precocious puberty, and infertility. Its ability to regulate hormone production in the body makes it an effective option for managing these conditions. Understanding the dosing information, potential side effects, and user feedback can help individuals make informed decisions about their healthcare journey. It is important to consult with a healthcare professional to determine the most appropriate treatment plan based on individual circumstances and needs. By considering alternatives, asking questions, and staying informed, individuals can work alongside their healthcare provider to ensure the best possible outcomes while using Leuprolide to address their specific medical condition.